Those suffering with chronic sinusitis often feel they have few treatment options apart from invasive surgery or the constant need for antibiotics. Today, minimally invasive procedures can be performed in office with little to no downtime, giving patients results that were once thought impossible. With more on the subject, here's Dr. Robert Bridge.
I'm Dr. Robert Bridge, and I'm an otolaryngologist, and I specialize in sleep disorders and sinus surgery. A recent study showed that there was up to 1 million patients in the United States that suffered from sinus disease that was significant enough that surgery would be beneficial for them. But these people were concerned about the approaches that they had heard about that were invasive and could potentially lead to significant downtime. So they're sitting on the fence needing the procedure that could decrease their suffering as far as need for antibiotic use, downtime from work, having the repeated infections. So a minimally invasive approach could be offered to these patients that could resolve their sinus issues, improve their ability to breathe through their nose, and the need for medication, just the recurrent infections, reducing that. It's important for the patient to know their options when they're looking at a procedure to treat their sinus disease. If we look in the past, the gold standard was tissue removal, to go in to remove potentially normal structures that are meant to be left in the nasal cavity to protect the sinus region. The sinus regions are very hidden back inside the nasal cavity, and if we remove and make a large opening into that sinus, there's concern that maybe pollens and bacteria that's in the air can get into the sinus easier now, and that could be a problem. So with the new approach, we're looking at trying to access that sinus opening using a balloon to dilate the natural opening, rinse the sinus out with either saline or an antibiotic solution to reset that sinus back to normal.
Welcome back. Unlike invasive sinus surgery, a procedure known as balloon sinuplasty allows doctors to open pathways to block sinuses with little to no trauma to the body. Here again is Dr. Bridge.
Balloon sinuplasty is a new procedure we're offering in our office, potentially under local. And the device that we use is a disposable device. It is meant to be used with one hand to deliver a balloon into the sinus. So the purpose or the goal is to dilate the opening to the sinus in a less invasive manner. So in order to do that, the device is well designed to deliver, first and foremost, a guide wire. And this guide wire is flexible, so when it is approaching the sinus area, it's not going to traumatize the tissue and go where it shouldn't go. It goes into the sinus. Now, once we're in the sinus, we'd like to know where that wire is because it disappears. And we have a tool that will deliver light. So basically using light, then we have a light that is coming out of the end of the fiber. And once we're into the sinus, or once we are in the sinus, that fiber will illuminate or shine on the cheek area or the forehead, the funnel sinus region or the maxillary sinus area. Once the guide wire is in place, advanced, we then can advance over that wire a balloon, and that balloon is advanced to position just halfway in and out of the sinus. And when it's in position and we're comfortable with that, the patient's comfortable, we then slowly inflate the balloon. And that balloon expands only to a specific diameter. It doesn't go beyond that. The balloon is quite firm and it will dilate the opening of the sinus, just as if we were trying to remove tissue or punching a hole in the sinus. Now we just use the balloon to dilate the opening. So by using the balloon to dilate the opening, there's less trauma and less risk of scarring, we believe. Long-term reports have shown the opening that we produce with the balloon lasts as long as punching a hole or cutting a hole into the sinus. Now, one question that patients often ask is, does the balloon stay in place? No. It's there just for a few seconds to dilate the opening to the sinus. We then deflate that balloon and then withdraw it back into our guide. with our device here, we have a way of removing the balloon and guide wire and then placing in an irrigation tool. The irrigation tool is unique in that the tip again is soft, but there are also small ports here which may be difficult to see, but that spreads the irrigation out like a sprinkler, basically coating the whole inside of the sinus. So this is placed in the guide. And we have the sinus guide again that gives us a specific angle to enter the sinus. The irrigation device can be passed by itself or potentially with the guide wire in place to get it up into the sinus. We now can irrigate the sinus to rinse out any mucus or bacteria that would be present in the sinus, potentially adding in antibiotic solution into this to sterilize the sinus cavity. Once that's completed, then we simply withdraw and remove it from the nasal cavity and the procedure is over. When we're completed with the procedure, the patient is obviously awake and alert and is able to walk out the door and go home and back to his normal activities that day. Today in our practice, patients are excited about having an option, a new option for treatment of sinus disease. I'm Dr. Robert Bridge, otolaryngologist, and I am a caring doctor.